Hi guys, this is going to be a super basic trach care video. I have my little patient right here, and before we get started, I have a homemade kind of trach here for demonstration. So this is the outer cannula here, and this is going to be the inner cannula, and I'm going to be showing you how to perform trach care for when the inner cannula is not disposable. So let's get started. I've performed hand hygiene and I'm going to put my gloves on. And if your patient needs suctioning, make sure that you do that before you perform trach care, because it kind of undoes all the hard work you just put in if you're taking out all the mucus and gunk in there. So if your patient needs suctioning, do that first and then do the cleaning. So I have my trach kit here and I have my sterile saline also. I'm going to open up my trach kit there, and I'm going to pour some of the saline into one of the reservoirs there. I'm being careful not to put my kind of non-sterile hand over that there. I'll close that up. Ideally, you would have a bottle for this. So now I'm going to take out the inner cannula, this top part here. It's usually connected with flanges. So you'd pinch those and take it out. You usually have to take it out on a curve. And so you can touch this outer piece that's black because it's not sterile. Everything outside the trach is non-sterile, everything inside the trach is, so that's something good to keep in mind. So I'm going to take that out and place it in the water. So now is the time to put on our sterile gloves. I'm going to take off my clean gloves, air myself out, and put on my sterile gloves. So first, careful not to touch the outside of the glove with my dirty hand. There we go. And then pick up the cup. Careful not to touch the inside with your second hand. So some trach kits you're going to have a platform, not a platform, like a sheet in there to make your sterile field. I just added one into this for demonstration. So here, I'm going to unfold it and just drape it down there. And then I'm going to take all the contents of this kit and put them on my sterile field. Some gauze, pipe cleaner, and the round brush, and a cotton swab. So at this point, my non-dominant hand is going to be non-sterile. So I'm going to be very, very careful with my right hand. So I'm going to open up my saline again. And at this point, since I've touched the outside of the bottle, this hand is not sterile anymore. I'm going to dip some of that in there. And I'm just gonna start cleaning. So with we'll do the cotton swab first. I'll dip that into the solution, and you want to use multiple swabs. Never use the same swab twice. And we're going to clean, from the inside out. Discard. There's some gauze in here. From the inside out. Discard. And then inside out again. There. All right, and then I want to dry it too. So I'm not gonna dip these gauze into there. And I'm just cleaning, drying, drying, drying. Perfect. And then at this point, I will take out the dressing there. Good. Discard that. And then with my dirty hand, I'm going to pick up the cannula again. And I'm going to clean it with the round brush. Discard that. And then your pipe cleaners are there for drying off the cannula after you clean it. So just kind of twist it around and then pull it through. And then your cannula is ready to be put back onto your patient. All right, and so now it doesn't have to be sterile anymore. So when I put on my new dressing, I can use both hands to stabilize the trach and put my new dressing underneath. And you want to make sure you're using dressings that are specifically for a tracheostomy, because regular 4x4s and gauze are going to fray and your patient can inhale that. And then usually your trach kit will have trach ties as well. This is when you would change those. His ties look pretty clean. And then sometimes, your patients might have the Velcro ties too. The ties don't always need to be changed every time you do trach care, just because, they don't get dirty as often as the other stuff. So yeah.